Hi everyone, I'm Amy Stein, the owner and founder of Beyond Basics Physical Therapy in New York City. I am the author of the award-winning book Heal Pelvic Pain and the creator of the video Healing Pelvic and Abdominal Pain. I am the current past president of the International Pelvic Pain Society, which is a non-for-profit to educate healthcare providers, bring awareness to the community, as well as educate healthcare providers in the treatment of pelvic pain and various pelvic pain conditions. I was asked by the U.S. Pain Foundation to answer some questions specific to vulvodynia, which is one of the pain conditions that I see as well as various pelvic pain providers see. The first question is, what should new patients know about their condition? I would say some of the things, there's a lot to know, but some of the things that the signs and symptoms do vary from burning, itching, sharp shooting, radiating pain. It could be a muscle pain, a nerve pain, as well as there could be bladder, bowel, sexual dysfunction going on with some vulvodynia patients. So it's really important to realize that you may have one of these symptoms or you may have all of the above, and that regardless, we are making efforts to learn how to heal and treat your pain. Getting a proper diagnosis from an expert physician or pelvic floor physical therapist or other healthcare provider is important to guide you in your treatment and what works best for you. Also knowing that the causes of vulvodynia vary, and it could be a hormonal condition that you are dealing with. It could be a musculoskeletal, an autoimmune condition that's contributing to your symptoms, bowel issues, bladder issues that's contributing to your symptoms. And then figuring out what specifically it is through the healthcare provider that you find, as well as using a multimodal and multidisciplinary approach to treating your symptoms is also very important, because again, usually it does involve more than one system that's being affected. Sometimes it is just one symptom or one condition that you are experiencing, and a hormonal medication may be the answer, or just pelvic floor physical therapy, if it's a musculoskeletal condition, may be the answer. But commonly we find that bringing in a physician as well as other healthcare providers, acupuncture, nutrition is also a great approach to treating vulvodynia. And again, not all healthcare providers are educated on what vulvodynia is and treatment approaches, so it is important to find the right healthcare provider for you. The next question is, what is the one thing you think every individual with vulvodynia needs to know? I would say realize that there are people out there that are trained and understand your condition, so it's important to find those people and get that team. It does take time and it varies person to person. So one person may respond in a couple sessions of physical therapy, or they may respond to one medication, whereas another person doesn't respond to the medication at all, or whatever else the condition may be. They may need a different approach than another patient with vulvodynia, because there are various conditions that fall under vulvodynia. There's localized as well as generalized vulvodynia, where localized is more pinpoint pain or local area that hurts, whereas generalized typically is the whole pelvic area, may go down the legs, may go up the spine. So that's important too, to realize that there are different treatment approaches depending on what your specific condition is. And then also that you should have a team approach, and ideally a team that is educated on vulvodynia, and figuring out what works best for you for your condition. How would you explain vulvodynia to a newly diagnosed individual is the next question. And again, I would say really knowing that the signs and symptoms vary, and whether it's localized and you just press on the area and it causes pain, or whether sexual activity is the issue, whether the bladder's involved, the bowel's involved, whatever it may be, trying to figure out what specifically is going on and getting a team to help support you and figure out what the treatment plan is for you. Also knowing that, again, there are various diagnoses, and making sure that you find the right healthcare provider to help with what the specific cause is. And again, that not all healthcare providers are as educated or educated at all in treating vulvodynia, so really trying to find that team. The next question is there any diet or exercise that can help manage or control the condition? And the answer is yes. Some people respond well to an anti-inflammatory diet. Some people need gluten and dairy. They're gluten or dairy intolerant, so they need a low gluten or gluten-free, dairy-free diet, but again, varies person to person. So if it comes to diet, a healthcare provider may be able to guide you in the right direction, or seeking out a nutritionist that is familiar with the treatment of vulvodynia. Also, low oxalate diet works for some patients. Some patients say it didn't help them at all. But again, depending on the cause of what is causing the vulvodynia. And then as for exercise, it's really important to keep moving. It's when you become sedentary, that just makes the condition, that can make the condition worse, because you're not getting the blood flow, you're not out, you're not exercising and reducing the stress in your life. So it's definitely important to do some physical activity, whether it's walking daily, doing elliptical, whether it's doing yoga, tai chi, qigong, to try to move and also calm the central nervous system, calm the sensitivities that have come about because of vulvodynia. And then there are certain books. My book, Heal Pelvic Pain, is a great guide towards self-care and learning what to do on your own. You could also take my book to a healthcare provider and show them what options are in the book, as well as helping to define what your specific condition is. And doing various massage techniques, breathing techniques to try to calm the nervous system, calm your system. Working to relax the pelvic floor is definitely with the breathing and exercise that we encourage patients to do. Gentle stretching is an option for patients. So there's a variety of things that you can do on your own, but I encourage everyone to see an expert pelvic floor physical therapist to guide them in their exercise routine, as well as seeing an expert nutritionist to guide them in their dietary changes. One other thing I do want to mention actually with diet is that constipation, hands down, makes bladder, bowel, vulvodynia, all the conditions of pelvic pain worse. So making sure that you address any constipation that you're having, whether it's meeting with the nutritionist, just adding more soluble, insoluble fiber to your diet, as well as drinking more water and fluids so that you can help your system to move along. There are massages that you could actually do to help with constipation. So there's a variety of things with that specifically that can help you alone. And then next question, where should I start my care? It really depends on what the cause is. So whether it's going to your physician, if there's a hormonal component to your condition and addressing that. If it's a musculoskeletal issue, you could go directly to a pelvic floor physical therapist in most states and most countries. Whether it's addressing the nutrition right away and seeing if the dietary changes can help. So it really depends person per person, but I would say that the most important thing is trying to find someone that is familiar with the diagnosis and treatment of vulvodynia. The next question is, how can I best educate myself about vulvodynia? There are various websites, and most of these websites have a find a provider. The National Vulvodynia Association, the International Pelvic Pain Society, the Interstitial Cystitis Association, those all have find a provider, and some of the websites do give information. I think all those websites give information for patients as well. In addition, if you're looking specifically for physical therapy, the American Physical Therapy Association section on women's health can help to find a provider in your area. Herman and Wallace Institute can also help find a provider. They also have information and resources for you as well. So do know that I've been treating this for over 20 years now, and I've seen the growth, and I see that there's a lot of more education, more research being done. Do know that we are on your side, and we are looking to help increase the awareness as well as education on vulvodynia, and there are providers out there. It sometimes takes a bit to find them, and it takes a team approach to healing your pain. Thank you very much.